Hello and welcome to this Photona training video. Today I want to demonstrate the 4D anti-aging and skin tightening technique. This is a really unique and bespoke treatment for Photona, giving 4-dimensional anti-aging results. It's a unique combination of ND-YAG and erbium YAG together. It's a 4-part treatment, plus there is a smooth eye treatment, which is a lovely treatment for around the periorbital region. Patients love this treatment. It's hugely popular because it has minimal downtime, minimal requirement for anaesthetic unless you're doing the smooth eye treatment, and it gives lovely results even in just one treatment. As with any collagen induction treatment, I would always advise my patients that for the best results and most superior results, you would need repeated treatments every 6 to 8 weeks. The aim of this treatment is skin tightening and anti-aging, and it really is a popular treatment. So now I'm going to demonstrate the treatment with my colleague Lydia. We're going to pay particular attention to the laser handpieces that we're using, to the settings that we're using, and to the laser technique so that you can incorporate this hugely popular treatment into your practice. Now we are going to demonstrate the Photona 4D treatment. We'll take you through everything step by step. So first of all, on the SP Dynamis, on the home screen you need to select Twin Light. After this you need to select 4D. Then click on the green folder on the left hand side, and this will allow you to ensure that you have the correct handpiece and you are with the steps 1 to 4 of the 4D treatment, and select step 1. And then confirm with a tick at the top. We will now be using the PSO3 handpiece with a 7mm spot, which is adjustable on the PSO3. And for joules, we'll be using 9 joules. If you are confident, then 2 Hertz is a good speed to start at. Lydia is now going to start the smooth lifting step 1 part of the treatment, which is erbium YAG intraorally. We're going to be starting with the buccal mucosa and move around inside the upper and lower lip and to the other side as well. What you'll notice if you listen is that Lydia is stacking 6 shots straight and directly on top of each other, 1, 2, 3, 4, 5, 6. And she will then move to, in a linear progression, to cover the entire area. She will then pass 4 times over this area, and that is the complete treatment. Our patient is tolerating it very well. If your patient finds it a little bit uncomfortable, then just reduce the number of stacks. Above the lip and below the lip, you would only do 4 stacks, but 4 passes at the same time. This is a very nice treatment for the nasolabial area and for lifting in this perioral region. We're now going to treat the upper lip. It can be a tricky area, so sometimes it helps to have an assistant, or the patient themselves can actually assist with you. So over the upper lip and the lower lip, we do 4 stacks, 1, 2, 3, 4, and 4 passes. So Lydia will now demonstrate. We are now going to be treating the lower lip. It's important to try and stay perpendicular to the tissue and nice and stable so that your 4 stacks are direct stacks. You will see some white marks on the mucosa to show you where you've been. And we would do 4 passes if the patient can tolerate it as such. We're now going to do step 2, which is frac 3 ND YAG. So if we go back to the screen, we're going to choose step 2 frac 3. We're going to be working with the R33 handpiece today. If you have the newer handpiece, it will be the R33T, which has temperature control and feedback. And then we will tick confirm. We're going to change the spot size to 9 millimeters. You could also use 6 millimeters or a 6 millimeter scanner. And now we want to drop the joules down to between 10 and 15. So we'll start with 15 and see how our patient tolerates it. We will probably adjust the milliseconds anywhere between 1 and 1.6, and the hertz can be adjusted as appropriate for the speed that you wish to work at. When we do this treatment, we split the face into segments and we work on each segment until we have erythema, which is our clinical endpoint in the area. So we're trying to heat the tissue up to about 42 degrees. This is to target the upper dermis. We can treat the whole of the forehead, cheeks, around the mouth and the neck area, and it's a lovely treatment. So Lydia's now going to demonstrate for you. It's just a nice, fast, sweeping motion. It's also possible to use the 6 millimeter scanner if you have a scanner. And as you can see, it's a very tolerable treatment for the patient. For those of you that have the new R33T, you have temperature feedback. When the light is green, you're about less than 40 degrees, and when it becomes red, you'll be roughly in the temperature of about 40 degrees. Very helpful so that you know where you are. Be also aware that if you have any male clients, this is very similar settings for hair removal. So you will be removing hair, or will definitely be at risk of removing hair doing this treatment. We've now completed the frac 3 segment, so we're going on to step 3. So back to the settings on the laser. We want to go now back onto step 3. So if you choose step 3, we'll be using the R34 handpiece and just confirm it by ticking. We'll be using the 20 millimeter spot size for the piano. And joules would be anywhere between 90 and 110, depending on how your patient tolerates it. And this is an ultra-long pulse ND YAG treatment. So this is really for deep dermal heating and collagen induction, so fantastic treatment. The idea is that in each area we'll stay about 5 minutes, getting a nice good erythema and warmth into the tissue as well. So we've now switched to piano mode. This is step 3, and this is deep tissue heating with an ultra pulse ND YAG. This is a very nice treatment for anti-aging. Again, if you have the newer handpiece, it's the R34T, which would have temperature feedback, and you want to be at about 43 degrees. It's a feeling of nice warmth for the patient, as you can see, very tolerable. It's a fast moving motion. We have a large spot size, so it's important that we don't dwell on any area and that we keep moving swiftly and smoothly across the tissue. As you can see, Lydia's chosen one area to work on where she's going to be building up the heat, and will remain here for about 5 minutes. Again, this is a treatment that can be used on the cheeks, around the mouth, on the neck. On the forehead, you'll always find that we'll have to do less passes. It's a little bit more uncomfortable on the forehead. Every time we pass onto the neck, we'll be placing a towel over the area as well. But as you can see, the patient is very comfortable throughout the treatment. The standard R34 handpiece doesn't give you temperature feedback, but it's very easy to see in the tissue, and you'll see that Lydia's constantly feeling for that tissue warmth and erythema, so she knows exactly where she is. That completes step 3, so we're now going to go on to step 4, which is the superficial peel with the erbium YAG. Going back onto the screen, we want to choose step 4, ultralight peel. We're using handpiece PS03, and then we'll confirm. We're going to use the 7mm spot size. We'll probably do between 1 and 2 joules, so perhaps we'll start with 1.5. And again, hertz you can set as you are confident. We are on multi-short pulse and basic. Okay, let's get started. So this is the superficial peel part with the erbium YAG. Lydia's going to be passing fast. She's chosen to work at 6 hertz because she's a very experienced practitioner. This will give your patient about a 1 to 2 day downtime with very fine peeling and maybe a little bit of redness. As you can see, as Lydia passes across the skin, you see some very fine white marks where she's passed. This is a really nice treatment for just those superficial imperfections. So this is a very superficial treatment. That now completes our Fotona 4D skin tightening treatment. As you can see, it's a very tolerable treatment for the patient. There's going to be very little downtime here after this treatment. Maybe 1 or 2 days of very fine flaking, and redness to the skin will settle very quickly. Lydia's now just going to clean our patient's skin, apply an SPF, and she will be able to go back and continue her day-to-day activities. I hope that's been helpful, and this really is a fantastic treatment for you to incorporate into your practice. Fotona 4D, Step 1, Smooth Lifting. This uses erbium YAG intraorally, treating the buccal mucosa, the nasolabial region and the perioral mucosa. Settings are erbium YAG, PS03 handpiece, smooth mode, 7mm spot, 9 to 10 joules, 2 hertz. 6 stacks and 4 passes in the buccal mucosa, and 4 stacks in the perioral region and the upper lip and the lower lip. Step 2, Frac 3, ND YAG skin tightening for the upper dermis. ND YAG, R33 handpiece, 9mm or 6mm spot, 10 to 15 joules if using the 9mm spot, 25 to 30 joules if using the 6mm spot, and 1 to 1.6 milliseconds. Step 3, piano mode, ND YAG for deep dermal and deep tissue heating. ND YAG ultra long pulse, R34 handpiece, piano mode, 20mm spot, 90 to 110 joules. Step 4, superficial epidermal peel with erbium YAG. Erbium YAG, PS03 handpiece, 7mm spot, 1 to 2 joules, multi-short pulse, and 1 pass.